You're welcome.
Good afternoon and welcome to another episode of Fertility Talk. As again, we are doing this series of talks with the doctors saying get to know your doctor, entitled Get to Know Your Doctor. And today we've got Dr. Heylen again from Cape Fertility. Thank you, Dr. Heylen, and thank you for always being willing to join us.
You're most welcome, Leanne. It's always a pleasure to speak to you. Thank you so much for the invitation.
Thank you, doctor. So we've only got 5 questions that we've asked all the doctors, and I'm loving that I'm getting a lot of interesting feedback, answers with these questions. So we're going to get right into it. The first question is, what inspired you to become a fertility specialist, and what keeps you passionate about this field today?
Yeah. And I don't think when you're 18 years old and we have to decide what you're going to become, that you're going to become a fertility doctor.
Mm,
And when I was young, and I'm still a little bit young, but when I was a bit younger, then fertility medicine wasn't a big thing yet.
yeah.
So when I was 18 and I had to decide what I was going to do, then I just said, yeah, I would like to become a doctor. And
Mm,
the passion to become a doctor that was for two reasons, because I wanted to do something that I was involved with people, and because it's something scientific, and that was my strong points at school.
mm,
And so that's why I decided to become a doctor, because I want to do something with people and try to help people. But I was not even thinking about becoming a specialist in anything. I was thinking like and a general practitioner would be wonderful.
mm,
And then when I started doing medicine, then I still remember that when I was doing, you have to go to the clinics, and then you are exposed to all the different disciplines. And when I was in the
mm,
labor ward, I was following a patient in labor. And then by the time that she had to give birth, I called the gynecologist to say this lady is now about to give birth. And then I was there, and the midwife was there, and the gynecologist was there. And then I asked the gynecologist who's going to do the delivery. And the gynecologist said, no, you're going to do it. I said,
mm,
me? And it was a tall, thin doctor, and he had these long arms. He was standing around me, and he was guiding me. He was standing around my back, and he was guiding me to deliver the. And then I had that baby in my hands, and it
mm.
was like a magical moment.
Oh,
And I give that baby to that lady, and I thought at that moment that's something I want to do later on in life.
wow.
Yeah,
Thank you.
that was a good moment. And also when I was in the operation room then a few days later, and then there was a cesarean section, and I also saw that was like a wonderful thing to do. So it was so not for fertility medicine that I um want to become an but was because of the obstetrics. So that
Yes.
was my first passion, to pregnancy and pregnancy care, and looking after ladies that are pregnant.
Okay. Thank
So
you. Yeah.
yeah, and then I obviously had to apply for that, and that was a quite a selective procedure. So then, anyway, I applied for it, and I got in. And then while I was doing that, then I mean, I really enjoyed it. But then at a given stage, um, I was attached to a clinic, um, and that's for other very strange reasons. I'm not going to go into that, but
Okay.
from a professor um, who was very much specialized in infertility. And he
Mm,
was one of the leading fertility specialists. He passed away 2 years ago, but he was a very intelligent man and a very kind man. And he was one of the leading fertility specialists in the world. So, and I was like his right hand, they call it his fellow, huh?
yeah.
For 1 year. That means that I could follow him, and I mean be taught by him and learn into fertility medicine. His name is Professor Ivo Brosens. Is a great man. And so when I was under his guidance, I became more and more interested in fertility medicine. And then when I qualified as an obstetrician gynecologist, I then also decided to become more focused on that. And I did an extra year of training in that field under guidance from the same professor. So, and then I had a South African wife that I met in the meantime, and I was working at that stage in Belgium, and because I'm Belgian,
Yeah.
and then my South African wife at a given stage wanted to come back to Cape Town, and that's when we moved to Cape Town. And there was another doctor here in Cape Town who just left Groote Hospital, and together we started Cape Fertility. That's now 30 years ago. It's a
Wow.
long, long, long time ago.
Yes.
And so for a long time we worked with two doctors, and then one doctor came as Dr. Leroux and Dr. Matabes and Dr. Oosters and Dr. Poteau, all the people that you know, and there was five of us um, that are here at the clinic. And it's now a wonderful, wonderful place to be.
Awesome. Thank you.
Yeah, it's infertility medicine, and not something that you can do as a
Yeah.
person. You can't do that as a person. You must do
Mm.
that as a team. You need a good team. You need a very supportive team. So from a colleagues, you need very good colleagues, and I've got wonderful colleagues. Like this morning, for instance, was one of my colleagues had a problem in theater. And then I came, and one of the other colleagues came, and and I helped a little bit, and then I had to go and see patients, and then the other colleague helped a little bit. So there was like a team effort. So we could really make sure that the procedure was done very well for the patient, because
Yeah.
it's a team effort. So that we don't feel alone. And
Yes.
also, if I go on holiday, or um, if I'm not available, then I know there's always somebody else available.
Yeah.
And also we've got the team of the IVF coordinators, all the nursing staff and the lab people that are all very qualified people. So it's like a team thing.
Yes.
So fertility is not something that you can do as a person. You have to
Yeah,
really have to
absolutely.
very, very, very good support around you. And that's what makes me stay in this job, because as you can see, I'm still young, but um, I have been doing this for quite a while, but it's
Mm.
with a very good team, with all the support structures around you. It's really a very nice job, because it's
Yes.
actually the best job in the world.
Yeah.
Because I can help couples to have a baby, yeah? And I
Yes.
mean, I see every day women that send me pictures of their babies, or couples that come and show me, see, oh, look at my little boy or my little girl, and
Mm.
or they come back for another one, and
Yeah.
or they send me pictures of their ultrasound in pregnancy. And in a lot of factors, for a lot of doctors, they have to deal always with a lot of suffering. People
Yeah.
that have severe diseases and they die. If you deal with heart
Yes.
disease or with cancer, so you've got a lot. But we are faced with a lot of happiness. I mean,
Yeah.
it's stressful because sometimes it doesn't work and there's a lot of stress going on
Yeah.
before. But there's an extreme amount of happiness that there is in our job, and that's plus the fact that we've got such a wonderful team here, and such a supportive team, and such a caring team, and such a happy team, and such a,
Mm.
very professional, highly qualified team with so many people that have got degrees in that one and that one and that one, and a master's degree in there and a PhD there. And it makes it like a really a great team to work in, and that's why I do this, and why I can still do this for a while, I think.
Yes. Okay, our next question. Thank you very much for that. Our next question is what's one thing you wish more patients knew before coming to their first fertility appointment?
Yeah, it's there are two things actually that are important, and general things. The first thing is the lifestyle, huh?
Yeah.
So always people they ask me, doctor, what can I take to make me more fertile? And the best thing what you can do for your fertility is not to take a supplement, or to take this vitamin or that coenzyme or that. There are a lot of different things, but to have a healthy lifestyle.
Yeah.
And that's nothing sexy, huh? And
Mm.
unfortunately, but that's what it is don't smoke, don't drink, eat healthy. Huh? So have healthy, wholesome fruits and vegetables and legumes and lean protein. Stay away from junk food and fast food as much as possible.
Yeah.
Do exercise. And that's the most important thing that you can do for your health, but also for your fertility. And that's something that I have to say every day to my patients. And it sounds like a very straightforward thing, but it is what it is.
Yeah.
And then the other thing is it's age. And there's also the thing that we have every day women that coming when they are in their 40s and they say, doctor, I've got very regular periods. I've got my period every month. And my doctor has done blood tests to say that I still ovulate every month. So I'm
Mm,
fine.
mm,
But you're not fine, huh? Because the egg quality deteriorates with age. And it goes
mm,
down not from the age of 40, but from the age of 35. That
mm,
means after the age of 35, you've got a reduced chance of conceiving and an increased risk of having miscarriages and abnormalities
mm,
of a baby. And that's why female age, male age also, there's now more and more evidence about male age, but especially female age is very important, and that couples should be aware of that, that female age is the crucial factor actually
yeah.
for all fertility treatments, and that the younger they come, the easier it is for me to
Yes,
help
yes.
them, and the higher the success rate is. So these are the things that I like to know the patients. That are things that we have to inform our patients about every day about age-related egg quality issues and
Mm,
lifestyle. And lifestyle is as important for the man as for the women. I would say it's nearly more important for the man because the testis is a very sensitive organ. So whatever happens to a man, any disease or sickness, very often has got an immediate effect on his sperm count.
yeah. Okay. Thank you very much. Our next question is, how do you unwind after a long day in the clinic or lab?
What do you think, Leanne?
I think cycling.
Yes, you got it. Jump on my bike.
You jump on your bike.
Yeah.
Okay.
So, I mean, I've got a road bike and I've got a mountain bike and I've got an indoor trainer. So I've got I can do a little bit of everything. So if the weather is bad,
Yeah.
then I jump on my indoor bike. If the weather is lovely, then I go outdoors. And if it's a bit in between, maybe on the mountain bike. Yeah.
Nice.
So that's my stress relief. And I mean, I've got a very um, different timeline now than when I was. I don't have kids anymore that I have to drop at school, so my kids are young adults now. So
Yeah.
I can now wake up in the morning and have to do nothing, huh? So I can
No,
just go to
nice.
work.
Very
So
nice.
I don't have to say, okay, pack your bag for school
Yes.
and drop you over there and drop that one at soccer practice. No, it doesn't happen anymore. So I can just jump in my car and go to work. So I'm
Yeah.
usually here at 6 o'clock. Then
Yeah,
I'm here.
yeah.
And then I see my first patient at 7 o'clock and I stop
Oh,
by 3 o'clock. Okay. So,
yes.
and then by 3 o'clock I stop, and then by 3:30, 4 o'clock I'm home. Okay.
That's nice.
That means then I still have got time to do something. And
Mm.
then my sport come. And even if I don't jump on my bike, then I go for a walk on the green belt, or I go to
Oh,
gym
I go
to,
there
to
all
lift.
often.
Yeah, yeah. Then there's a green belt around the corner from us. Or
Oh,
I go to the gym to lift some weights because I say that people that are not so young anymore must lift some weights to
mm.
prevent osteoporosis. So
Yeah.
I mean that's what I'm doing then also. But
Yeah.
yes, I try to do every day, every afternoon to do some physical activities,
Yeah.
and I program it also. So I
Yes.
also make sure that it is. So today I know what I'm going to do. I've got a spinning class of 4:30.
Oh,
So
nice. Very
so
nice.
yeah. So and I'm looking forward to that one already. So yeah.
Nice. Okay, so our next question is, what has been one of the most memorable or rewarding moments in your career so far?
There's been many, and it's not that and one that I can say, but one of the best ones I think was that we had that woman who had cancer treatment, and we did
Mm.
ovarian tissue freezing. So we took
Oh,
out piece of her ovary and we froze it. And then she had all these treatments done. And then afterwards, she was menopausal. And then she had no eggs anymore. And then we took that ovarian tissue and we re-implanted it. And then she conceived a few months
oh,
later. I mean, that was the first one ever done in Africa.
wow.
It was done about 15 years ago by Dr. Sulaiman and myself. And it was a very, very satisfying, fine thing to do. So that was, yeah. But there have been many, and you've got always these little success stories that you have, and then we share it with our colleagues from difficult cases, and then one day the lady is pregnant, and then we get a picture of that healthy baby born, and then we are so happy. So
Oh,
so yeah. But I think that one case that I mentioned, that was one of the most memorable things. It was a very special case. Yeah.
Thank you. Thank you, doctor. Our very last question is, if you weren't a doctor, what do you think you would be doing instead?
I don't know. Huh? I really don't know. Huh? Because mm, if if I think back when I was younger, also when I was dis deciding, so I was looking at becoming an engineer, and then I went to the information. I said, no, that's nothing for me,
Mm,
or biology or a scientist. And I say, yeah, that's interesting, but I don't want to do that as a person. I'm
mm,
also not a person who was going to go into anything like financial or business like, because it's
yeah,
also not the thing that I wanted to do. It would always be something more with people and
yeah,
something similar, like a dietitian or a personal trainer or something like that. Are things that also that personally interest me, like
yes,
fitness in general does interest me,
yes,
and everything related to diet and healthy lifestyle. I mean, you could maybe hear it already from all the things that I've been
yes,
saying.
yes,
I've got
yes,
a very much a personal interest in these things. So I
yeah,
would probably branch out in something like that if I wouldn't be a doctor,
yeah,
but not something like law or
yeah.
engineering or business, or because I don't see myself doing something like that.
Okay.
No.
Thank you very much, Dr. Heylen. It's always a pleasure talking to you and listening to you. And we really see the love that you have for what you do shine through with this.
Thank you. Thank you, Leanne.
So thank you very much for that.
You're
Thank
most welcome, Leanne. Nice to talk
Thanks.
to you.
So Dr. Hayden is at Cape Fertility Clinic. So if you want to get hold of him, you can go to the website is www.cape, which is capefertility.co.za. And you can also email him. I think it's S. Hayden. But you are welcome to just go onto their website and you can give them a call as well, or you can DM myself, and they are on every social media platform. You can contact them that way. So thank you very much, Dr. Hayden.
You're most welcome, Leanne. You take care.
Thank you. Have a great afternoon. Bye.
Bye bye.